the AM News with me, Sweetie Aboshi. Starting with the opposition NDC is sounding the alarm over an alleged scheme to jail minority leader Dr. Ato Forson at all costs. In court on Thursday, the third accused person, businessman Richard Jakpa, alleged under cross-examination that Attorney General Godfrey Dame has been reaching out to him to incriminate the minority leader Dr. Ato Forson. Now, the NDC has been reacting furiously to this.
A scandal that just happened in the case of Honorable Ato Forson versus the Republic and other accused persons. As you may be aware, our minority leader and Member of Parliament for Ejumaku Enyan Isiam, the Honorable Dr. Ato Forson, who served as Deputy Minister under the ex-Wal NDC Mahama government, is standing prosecution for his role in the procurement of some ambulances by the then government. We've always maintained, as far as this matter is concerned, that we don't believe that the Akufo-Addo Bawumia MPP government is up to ensure that justice is done in this matter, and that this is a clear case of persecution and not prosecution. And we have times without number explained why we think that Honorable Ato Forson is innocent and that this whole case is needless. Now, the matter has been before the courts. Various witnesses have been called. The minority leader himself has opened his case and closed his case. Currently, the third accused is being cross-examined by lawyers for the minority leader, who is the first accused. And today, cross-examination was done by our own Director Legal, Eduji Tamaklo. So we're all in court to monitor the proceedings. But we were shocked to the marrow when the third accused, under cross-examination, disclosed to the courts that the Honorable Attorney General has been reaching out to him, calling him over the phone, and that he has met with him in person, and that the Attorney General has been asking him to give false testimony to the courts and skew his testimony in such a way that corroborates the case of the Attorney General against the first accused, so that the first accused can be convicted and jailed. He said this in open courts and asked that it should be put on record. And her ladyship also directed that same should be captured by the record. And so what we are talking about is something which is on record. And we as a political party are totally scandalized and disgusted by this development. We are not surprised because we've always known that this is a stock in trade of Godfrey Dame.
Meanwhile, State Attorney and the spokesperson for the Attorney General's Department, Isaac Wilberforce-Mensah, has denied the allegation, saying it's much ado about nothing. He spoke on Joy FM's Top Story.
If indeed what happened in court indeed happened, the question is, has any wrongdoing been done? That is the question. Has the Attorney General acted lawfully? If indeed he acted in the way that he is being or is being told in the media that he acted, has he acted unlawfully? The answer is no. If you look at the law, does the law permit prosecution to speak to an accused person in the middle of a criminal trial?
Wilberforce, if the Attorney General himself is coercing a witness to make a case against someone is prosecuting.
That is not true.
How do you then answer that he's done nothing wrong?
Has not coerced anybody to make a case against anyone. The Attorney General himself has denied emphatically that he has not asked anybody to make any false testimony against anyone. Remember, the Attorney General is not even the judge. There's a judge in the matter. And there are lawyers for the accused person also in this matter. If a false statement has been made, can the lawyers even cross-examine on that false statement? All this is more or less much ado about nothing.
In other stories, radiation oncologists at the Kolebu Teaching Hospital say they are being forced to place women living with cervical cancer on long waiting lists because there are only 2 radiotherapy machines serving the thousands of patients suffering from the terminal disease. Approximately 3,000 cases of cervical cancer are diagnosed annually in Ghana. Joy News' Adobe Asari was at a forum organized by Meg Sharp and Dome to promote education on a disease and reports it can take a cervical patient at least 3 months to be placed on a radiotherapy machine.
Cases of cancer are diagnosed in Ghana each year, with 60% of affected patients dying from the disease. This high mortality rate is largely attributed to a lack of knowledge about the prevention, early detection, and insufficient human papillomavirus (HPV) vaccination coverage. Speaking at a dialogue organized by Meg Sharp and Dome MSD on cervical cancer awareness, specialist radiation oncologist at the Kolebu Teaching Hospital, Dr. Mary Ann Dadzi, lamented over the inadequate radiotherapy machines available at the facility. She said the situation is not only putting pressure on the existing machines, but is leading to the death of many women who are placed on long waiting time before they are treated.
So there are 2 government radiotherapy centers in the whole country, one in Kumasi, another in Accra. They were established in 2000 for 20 million people, and we are 34 million now. And it's still those 2 centers with 2 machines. It's terrible. Now, the waiting time to get onto the machine is about 3 months. Yes. That's a waiting time to get onto the machine. And the machine is breaking down every now and then. If you have money, you can go to the private center. But how many people can afford $3,000 or $4,000 for just the radiotherapy? So they wait, and sometimes when it's time for treatment, you call them, oh, the woman is dead. You call, is dead. We call them and they come in with metastasis all over. It's too late.
In Ghana, around 1,800 women die from cervical cancer each year. This high mortality rate is primarily due to the lack of vaccination, delayed detection, and insufficient awareness about the disease. Managing Director of MSD, Dr. Zweli Bashman, said, addressing these gaps is crucial to reducing the impact of cervical cancer on Ghanaian women.
I think it's important that as a healthcare fraternity, we focus on this. It is the #1 sort of cancer that, with the highest level of mortality on the continent. I can safely say that awareness levels are not where they need to be. And that's part of the work that we need to do. Ours is not just to work on the research, development, and manufacturing, but we need to create an ecosystem that is accepting of these healthcare interventions. So we spend a lot of our time and effort doing community social mobilization work, healthcare practitioner as well as healthcare consumer education. We work with religious bodies in terms of providing them with education. We work with, cultural leaders, providing them with education and information.
Addressing the issue of vaccination, Program Manager of the Extended Program on Immunization, Dr. Kobina Amponsa Achiano, noted that intervention is underway to start a HPV vaccination by October 2025.
Fortunately, the Minister commissioned the National Immunization Technical Advisory Group to advise it, and the group advised the minister effectively. So fast forward, April this year, we put in an application to Gavi, which is undergoing screening. And so hopefully by October 2025, we should be starting Ghana's program on HPV.
By raising awareness and improving access to preventive measures and early detection, the MSD, in collaboration with the Ministry of Health and other stakeholders, aim to significantly reduce the impact of cervical cancer in Ghana and Africa in general.
Still on health, nurses and midwives in the Bono East region have been urged to improve their customer care as part of efforts aimed at helping patients cope with their recoveries. This call was made by the Deputy Regional Director in charge of clinical care, Helen Agbojo, at a brief program in Kintampo to mark the 2024 Nurses and Midwives Week. Correspondent Anna Sabit has more in this report.
The week-long celebrations marked around the world is mainly to acknowledge the compassion, professionalism and round-the-clock commitment of nurses and midwives caring for patients in the public health system. Chief Nursing and Midwifery Officer for Bono East Region, Ms. Joyce Ishen, who was speaking on the sidelines of a brief program held in Kintampo, underscored the significance of the work nurses and midwives do across the Bono East enclave.
It's very important. Looking at the theme for this year, our nurses and midwives are future, the economic power of care. This theme throws more life. It focuses on the in-depth analysis of what nurses and midwives are doing in the region. And also, when you look at it, it also gives us the investment that nurses and midwives deserve. We have to invest in them. We have to see them as an investment, not a cost. So we plan that we have to celebrate our nurses and midwives so that they can do more.
Ms. Joyce Shen, however, bemoaned the equity index of nurses in the area and was quick to add that the high number of females in the nursing profession goes a long way to affect the efficiency of nurses across the area.
The equity, when you talk of equity, in some areas we have more, in some areas they are not willing to go because of one or two reasons. So it's not encouraging at all. And as I said earlier on, looking at the nursing population, you realize that about 76% of us are females and the rest are males. And they are also in their reproductive stage, average age of 35 years. So they are reproducing, they are giving birth. And when a nurse is pregnant, it means that nurse cannot run the normal shift for 1 year, 9 months. Why am I saying this? Because the person is pregnant, the person is not going on night duties. So if you don't have enough nurses to run the night for you, those who are not pregnant, who haven't delivered, to run the night program for you, it becomes a challenge.
Deputy Regional Director in charge of clinical care, Ms. Helen Agbojo, was thankful to the nurses for their sacrifices over the years, but was quick to appeal to them to improve their customer care. A move, she said, would help enhance the health of the patients they attend to.
The week as a whole means a lot for us. We want to use it as an opportunity to celebrate our very hard-working nurses. Aside appreciating them and congratulating them, we also need to, express some of the areas or the desires that we think they need to improve upon in the healthcare system. One for me is the customer care, which I will always speak about, the need for us to accept people, to treat people with a lot of respect and dignity. A little smile for a patient, it goes a long way to help them. And so much as they are doing well, we want them to open their teeth and be nicer to the people who come to them on a daily basis. A little help here and there, more than they are doing. We are not saying they are not, they are actually doing very, very well, but we just want to encourage them to do better for humanity.
The 2024 Nurses and Midwives Week was observed under the theme, Our Nurses and Midwives, the Economic Power of Care. Anna Sabit, Joy News, Kintampo.
According to research, traditional farming methods often produce harmful pollutants that contribute to climate change. Maize and rice farming have particularly been implicated in the release of harmful gases into the atmosphere. The Crops Research Institute of the Council for Scientific and Industrial Research is therefore exploring various agricultural technologies to combat this menace through the Agroecology and Circular Economy for Ecosystem Services project.
This 4 years project seeks to explore innovative techniques that can reduce these pollutants while improving the health of the soil and the crops. As part of the project objectives, scientists will try out different methods of farming, such as crop livestock system, integrated soil fertility management, composting, biochar application, site-specific nitrogen management, rotational cropping, among others, to see which ones work best for the environment and for farmers. The scientists will then build the capacity of farmers and policymakers on these technologies. Speaking at the project launch, the project coordinator, Dr. Kwaku Asante, was hopeful the adoption of these technologies will lead to better farming outcomes.
The key objectives are to assess the effectiveness of agroecology and circular economy technologies in reducing short-lived climate pollutants emission from agricultural fuels, and then to develop and validate ACE practices tailored towards agroecological zones, focusing on maize and rice production systems.
The director of Crops Research Institute, Professor Moses Mucha, touted the institute's quest to pursue initiatives aimed at combating climate change.
As the lead institution for this project, we are deeply honored to spearhead efforts aimed at integrating agroecology and circular economics principles into maize and rice production systems.
Director General of the CSIR, Professor Paul Busu, was also grateful to the stakeholders for the realization of the project and asked for their commitment towards achieving the goals of the project.
Agroecology and circular economy principles, we are embarking on a journey towards sustainable and resilient food systems. I extend my heartfelt appreciation to all the partners and stakeholders who have contributed to the development and implementation of this project. Your dedication and collaboration have been instrumental in bringing us to this point.
Minister of Environment, Science, Technology and Innovation, Mrs. Ophelia Mensah-Hayford, pledged the government's support and urged the Council to intensify communication and advocacy of their activities. Reporting for Joy News, Kwesi Deborah.
Now, school trunks are every boarding student's treasure box. They are symbols of organization, security, and a home away from home. But have you ever wondered about the hands that craft these essential items? Well, Joy Prime's Florence Ahogbade caught up with 23-year-old Justice Kwesi Arthur Jr., who inherited the art of trunk manufacturing from his father. Here's a report.
I found myself here in Palladium, where craftsmanship runs deep in the veins of the community. Today, I will dive into the age-old tradition of trunk manufacturing, where skills are passed on from generation to generation. Come along.
In the lives of boarding students, trunks are more than just storage containers. For students, a trunk is like a treasure box. It has nearly everything: books, clothes, and other personal effects. In the trunk, students learn how to organize stuff. Meet Justice, a 23-year-old man who learned the trunk-making business from his father. From a young age, Justice has been immersed in the essential pieces for students.
For the trunk business, that's my dad's occupation. So growing up as a kid, I'll follow him here on weekends. Then he'll be like, "Oh, just do this for me, do this for me, do this for me." Then I'll do it. So I was with him learning alongside. So after junior high, that's when I came to work with him. I'll follow him every day, come and work with him. Yeah. So even when I go to school as an SHS, when I vacate, when I come back, still be with him. Then after SHS, that's how I got into it. We get a material from the market, that's timber market. That's blue. We get it, buy, then we straight the plate, we mark it. We have a pattern, already made pattern. So we put it on it, mark it, cut it. Then we start molding. So we mold, then they wet, then we come and cover, then they grind it. The boys grind it, then they spray, and we wrap it.
Making trunks is not merely a business. In every box, he builds and welds on his father's legacy with pride. The demand for trunks is especially high during the back-to-school rush, with Justice selling up to 50 trunks a day.
Yeah, so they'll come here, you see them. Even if you are far, you see them here. It's like, see them walking here about, playing to people with their mothers, coming in and out. But like, it's very busy over here. During that period, we can sell a lot. So generally, my dad can sell approximately 70, 80 in a day. If you say you are waiting till that period before you start making, the period will pass and like you're still not finished.
Metal trunks are known for their durability and are preferred over wooden alternatives like chop boxes.
If we don't make the trunks, they don't go to school. I went to boarding school, so I know how it is. People can, with the chop box, people can just break the under. It's just nails. So we just remove the under and then you lift it, then take your things. But with trunks, how it is made, you can't open somewhere, like it has been even welded. So it's hard to break in.
Despite studying cinematography, Justice sees the trunk making business as a stepping stone to realizing his dreams.
I'm a cinematographer. But the plan is gather money here, then invest into my cinematography dreams.
For Justice, there's no shame in his job. Trunk making is a tradition, a decent source of livelihood, and a passion. Florence Ahodagbe for Joy Prime.
Coming up is Business Update.
Well, thank you for staying. Now in our first story. The Chamber of Bulk Oil Distributors is upbeat about operating at full capacity following the decision by the Tanker Drivers Union to resume work after embarking on a sit-down strike. The tanker drivers yesterday resolved to call off their strike after engaging in a series of meetings with the NPA, OMCs, among other key stakeholders, to drum home their demands of remuneration and conditions of service. Now, reacting to the development, the Chief Executive Officer of the Chamber of Bulk Oil Distributors, Dr. Patrick Kwekwofori, stated that the resumption would enable their members to sell their products expeditiously without hindrance. He spoke to Joy Business.
On our part as a chamber, we are also discussing with our terminals to work extended hours from tomorrow as soon as the drivers meet their people and they are able to communicate to the general public that they call up their strike. Once they do that, we are committed to ensure that we work extended hours from tomorrow to the end of the month, and then even Saturday and Sunday, so that every part of the country can receive products to avert any potential shortage, which will also help create woolage so that the vessels and the BDCs who have got products at anchorage can also reduce their burden of demurrage.
Now, in our second story, the Minister for Trade and Industry, Katie Hammond, has reaffirmed government's commitment to invest in entrepreneurs in the country. The minister says his outfit will harness the efforts of micro, small and medium-sized businesses to promote Ghanaian products and services in foreign markets through Ghana's diplomatic missions abroad. He was speaking at the opening ceremony for the third Made in Ghana Bazaar, organized by the Ministry of Foreign Affairs and Regional Integration.
After staying off for 3 years due to the outbreak of the COVID-19 in 2020, the ministry has bounced back with more interesting exhibitions from participating exhibitors. The 3-day event, which is expected to be climaxed on Saturday, May 25, 2024, involves a variety of activities with the opening ceremony beginning on Thursday. Minister of Trade and Industry called on SMEs to be resilient.
Our responsibility to continually facilitate
improvement in the business environment. So government would ensure that framework conditions for doing business with ease exist, and thereby facilitating your continued success in keeping local production and supply chains efficient and sustainable for manufacturers. It's in keeping with this that I have promised to get the business regulatory reforms bill.
Deputy Minister of Foreign Affairs and Regional Integration, Mavis Nkansa-Boadu, said the bazaar is to utilize diplomatic missions to facilitate the entry of Ghanaian product into foreign markets while strengthening relationship between local industries and foreign partners.
As it is strategically designed to harness the innovativeness efforts of our micro, small, and medium-sized businesses. Ladies and gentlemen, Your Excellencies, the goal of the bazaar is therefore to facilitate the penetration of Ghanaian products and services into the foreign market through the network of Ghana's mission abroad and diplomatic missions accredited to Ghana, which will invaluably support the growth of our SMEs and provide them with the needed impetus to expand their reach into markets, including the African Continental Free Trade Area.
Some SMEs were delighted for the resumption of the bazaar.
I think putting us on the map, visibility such as this is very key. Getting out there, knowing about the brand to others, key stakeholders, partnering with ministries, Ministry of Finance and Trade and Industry. Example, having this fair, for example, the Ministry of Foreign Affairs having this Made in Ghana bazaar is a very good opportunity. And a company like mine, which is located in Malaysia and registered in Malaysia as well as Ghana, this is a very good opportunity for me to showcase the products as the founder and CEO of the brand.
The event is under the theme Promoting Made in Ghana Goods and Services for Economic Prosperity.
And that's how we put a full stop to our business update for today. Thank you for allowing me to serve you. Back to you, Sweetie Award.
Yes, Benjamin, bringing us to the end of the bulletin for the AM News. Newspaper Review segment is up next. See you in a jiffy.